Hello again. In this first lecture of Week 8, our mission is to examine research on youths who are placed in various types of juvenile correctional programs. The information that I will present is derived from your readings this week. One of these is the readings by Sedlec and McPherson, who present findings from the Study of Youth in Residential Placement, the SYRP. This is an important source of information because the data are gleaned from youths themselves. The other source for this lecture is the reading by Taplin et al., who conducted a longitudinal study of youths arrested and detained in Cook County, Illinois between 1995 and 1998. This study, called the Northwestern Juvenile Project, was intended to better understand drug, alcohol, and psychiatric disorders within a large sample of youths who were detained. More about these studies can be found in the readings. Earlier in the course, we spent some time thinking about adolescents in general and about youths who are likely to come into contact with the juvenile justice process. As you will recall, this population of youths is quite diverse. As youths penetrate deeper into the juvenile justice process, past diversion, adjudication, and community-based placement, we find that many of these youths face multiple problems. It is important to address the problems that these youth experience for at least two reasons. First, because they are minors, they deserve our best efforts to help them develop into happy and productive members of the community. Second, failure to help them address the problems they face has significant social and financial costs for the communities in which we live. These social costs include additional delinquency, crime, and victimization of members of the community, and the financial costs associated with that victimization. The financial costs include the cost of incarceration, lost earnings by the offender, welfare costs, lost tax revenue. In fact, it is estimated that trying a juvenile as an adult and giving them a 50-year sentence, by the way, there are about 2,500 persons presently serving life sentences for offenses committed as juveniles, that this cost about $2.25 million. So what do we know about the needs of youths who are placed in juvenile correctional facilities? One thing the research makes clear is that many of these youths have emotional and/or mental health problems. Unfortunately, 47% of youths in custody are in facilities that do not screen all youth for mental health needs. One problem presented by a significant percentage of youth in correctional settings is anger. The SYRP data indicated that less than half of youths in residential placement, 43% in fact, had committed a violent offense. However, more than 60% of the youth in placement indicated that they are easily upset or quick to anger. Another common problem noted in the SYRP data is the level of anxiety and depression found in institutional populations. The SYRP data reveal that over half the youth in placement reported symptoms of anxiety or depression. As Sedlec and McPherson note, suicide is the third leading cause of death among adolescents, and a prior suicide attempt is a strong predictor of suicide completion. Among youth in placement, 1 in 5 reported 2 or more recent suicidal feelings, and 22% had reported a past suicide attempt. This is a rate more than twice that of the general adolescent population. Similarly, results from the Northwestern Juvenile Project indicated that 10% of detainees had thought about suicide in the last 6 months, and 11% had attempted suicide at some point in their lives. Also, this study found that psychiatric disorders were common among detained youth in Chicago. There, almost 3/4 of the females and 2/3 of the males were found to have some form of psychiatric disorder. As you know from earlier in the course, adverse childhood experiences, including trauma, are associated with a variety of negative adolescent and adult outcomes such as delinquency, crime, victimization, mental and physical health problems. According to SYRP, among youths in placement, 70% reported some type of traumatic childhood experience, and 30% reported some type of physical or sexual abuse or both. Moreover, the SYRP data found strong correlations between childhood experiences and suicidal ideation among youth in placement. The Chicago study found even higher rates of trauma among the youths in that study. Of the youth detained in Chicago, 9 out of 10 youth were found to have experienced some type of trauma during their childhood. In the Chicago sample, 83% reported some type of physical abuse. Moreover, 1 in 10 youth detained in Chicago met the diagnostic criteria for PTSD. One thing to note about youth in juvenile correctional facilities is that many have multiple disorders. In fact, about half the youth in placement may have multiple disorders. For example, the Northwestern Juvenile Project found that 57% of females and 46% of males had 2 or more psychiatric disorders. Although the SYRP data indicate that a wide range of counseling and mental health services are available to use, only a little more than half of youngsters, 53%, in placement reported that they had met with a counselor. A similar finding was noted for the Chicago sample, where only 18% of youths with major psychiatric disorders and associated functional impairments received treatment in detention, and only 8% retrieved treatment in the community after their release. Moreover, little is known about the quality of the service that youths do receive. Although many youths in correctional settings are at risk of self-harm, COR321 and McPherson found that individual screening for suicide is not common. As the SYRP study found, more than 1/4, about 26% of youths in placement, are in settings that do not screen all youth for suicide risk, and 45% of youth are in facilities that do not screen all youth for suicide risk within 24 hours of admission. In addition, screening for general mental health needs is also limited. Of the 53% of youth who reported receiving counseling services, 80% reported that the counseling they received was very or somewhat helpful. Unfortunately, our ability to assess the quality of services provided is limited. While most youth are in facilities where trained mental health counselors provide ongoing therapy to some youth, how many youth receive counseling from professionally trained counselors is not known. Many youth receive counseling from persons who are not trained mental health service providers. Moreover, more than 1/4 of youth are in facilities where the staff conducting suicide prevention screening are untrained. With respect to substance abuse, youth in placement are more likely to have tried drugs and alcohol than youth in the general adolescent population, and more than 2/3 of these youths reported problems associated with their drug use, such as getting into trouble when they were high, not taking care of responsibilities, or suffering a blackout. High rates of substance use are also found in the Chicago sample. Among youths detained in Chicago, half the males and almost half of the females were found to have a substance use disorder. However, nearly 1 in 5 youths, about 19%, are in facilities that do not screen youths for substance use problems, and slightly over 1/3 are in facilities that do not screen all youths for substance use. Moreover, the use of urine tests to screen for drug use is spotty in juvenile facilities. Less than 1/3 of youths are in facilities that test all youth for drugs at admission. When substance use issues are discovered, youths are more likely to receive substance use services. However, reporting substance use problems does not mean youth will receive services. In fact, less than 2/3 of youths who report substance use problems actually receive assistance. Moreover, the quality of the services that many youth receive are suspect. The SYRP data, for example, indicated that the youth who reported the greatest need for substance use treatment were the least likely to report that the treatment they received was helpful. Another type of problem experienced by many youths in residential settings is health problems. Many children involved in juvenile justice, and this is certainly true of youth in placement, have health problems. The SYRP data indicated that more than 2/3 of youth in custody had a health care need. The most pressing needs among this population were dental, vision, or hearing needs, but almost as many had needs related to some illness or injury. It should also be noted that those youth who had penetrated deepest into the institutional system often had the most needs. One health-related behavior that was assessed by the Northwestern Juvenile Project that was not addressed by COR321 and McPherson was HIV/AIDS risk behaviors. In the Chicago project, Teplin and her colleagues found that about 95% of detainees had engaged in 3 or more of these risk behaviors, and 65% had engaged in 10 or more of these behaviors. Although the health care needs of youth in institutional settings has been recognized for many years, as COR321 and McPherson note, there is no universal standard of health care for youth residing in correctional settings. Moreover, according to the SYRP data, more than 1/3 of youth believe that they do not receive all the health care that they need. Another problem faced by many youth in correctional placement is that they are behind academically. Slightly over 1 in 5 youth in placement were not attending school when they were taken into custody. Almost half of youth in placement are also below grade level for their age. In addition, about 6 in 10 youths in placement reported that they were suspended or expelled during the year before they were placed, and 1/4 reported that they had been held back a year in school. Like the other services provided to youths, the quality of educational services is mixed. Over 9 in 10 youths in custody attended school. However, youths in placement spend less time in school compared to their counterparts in the general population. Moreover, only about half of youths in placement believe their facility has a good educational program. Also, about 1/3 of youths in custody indicated that they have a learning disability. However, less than half of those with a learning disability actually receive special education services, even though law requires them to receive these services. Another issue that is important to recognize is the needs of females in correctional settings. These needs have been receiving more attention over the past 10 to 15 years. The SYRP found that girls in residential settings are more likely than boys to present both mental health and substance abuse problems, and they are more likely to report traumatic experiences compared to males. Similar findings were noted in the Chicago study. That study found that females are almost twice as likely as males to report physical abuse, are more than twice as likely as males to report previous suicide attempts, and are more than 4 times as likely to report sexual abuse. However, while females were more likely to be placed in residential facilities that provided mental health treatment services, they were no more likely than males to report actually receiving treatment. Also, while females report more problems with substance use than males, females are less likely than males to be placed in facilities that provide substance use treatment. As the SYRP study notes, females have different health care needs than males. Overall, females have more health care needs than males, and they are more likely than males to take medication to deal with emotional and mental health issues. However, females are less likely than males to report that they receive all the care that they need. In terms of the areas examined by Sedlick and McPherson, education is the only area where females do not have greater needs than males. There are a couple of things I should note about the SYRP and Northwestern Juvenile Project studies. These studies are not directly comparable. For example, the SYRP looks at a range of placement types and covers a more diverse population of youth. The Northwestern Juvenile Project focuses attention on youth who were detained in Cook County, Chicago, an urban population. Nevertheless, these two studies provide us with some important insights about youth who are detained and are placed in a range of residential settings around the country. Remember, all the individual statistics I have provided you in this lecture is not important. What is important, however, is the picture of youth in placement that these numbers represent. The picture is clear. Many of the youth that are found in institutional placements are confronted with significant challenges. Many are angry, many have significant mental health and emotional issues, many have substance use issues, many have mental health issues, and many have significant educational deficits and special education needs. Unfortunately, in too many cases, youths do not receive the help they need in dealing with these challenges. As a result, many of these youths face diminished prospects for living happy and productive lives. As the Northwestern Juvenile Project makes clear, youth may not get the needed treatment services they need within the community. Moreover, some of these youths will develop even more significant disorders, and they will have high mortality rates, significantly higher than the general population. This concludes the first lecture this week. I realize that I am ending this talk on a rather somber note. Perhaps the next lecture on the characteristics of effective interventions will prove to be a bit more uplifting. See you next time.